Hi, everyone. I'm Yvonne Copeland, the Director of the Division of Child and Family Wellbeing at the North Carolina Department of Health and Human Services. Here at the North Carolina Department of Health and Human Services, we are committed to achieving our vision that all children are healthy and thrive in safe, stable, and nurturing families, schools, and communities. To achieve this vision, we have established a new division of child and family well-being that brings together programs and staff that have historically operated across multiple divisions under one roof to support the physical, behavioral, and social needs of children. In establishing this division, North Carolina is bringing together three major nutrition support and education programs for children and families: SNAP, known as FNS in North Carolina, WIC, and the Child and Adult Care Food Program, with the goal of making it easier for families to enroll in these programs and access nutritious food. Additionally, the division complements the nutrition programs with early intervention programs, which provides supports and services to children ages 0 through 3 with developmental delays or established conditions, as well as health-related programs and services, and school and community mental health services for children and youth. Through the Division of Child and Family Wellbeing, we will coordinate investments to improve child health and well-being with the focus on closing equity gaps. An early area of focus will be the maximization of the federal American Rescue Plan funds to make it easier for families to access FNS benefits and mental health services for children and youth. Addressing food insecurity is one of our top strategic priorities for the Division of Child and Family Wellbeing. We all know there's extensive research about the negative impacts of hunger on children's physical health, mental health, educational outcomes, and social emotional development. We are nearing 2 years into the pandemic, which has exacerbated food insecurity. 1 in 5 children in North Carolina are food insecure. We know that hunger impacts some communities more than others. Our Black, Latinx, and rural households have experienced disproportionately higher rates of food insecurity. And we have an equity lens at the department in the forefront and our forefront as we develop policy solutions. The North Carolina Department of Health and Human Services team has been working hard to mitigate these impacts and close equity gaps. And there is more work for us to do to invest in our children, to build resilient families, to achieve better health and educational outcomes, and to strengthen our society.
Hi, everyone. I'm Madhu Valamiri, Deputy Director of the Division of Child and Family Wellbeing at NCDHHS. In my role as Deputy Director for the division, I oversee the Community Nutrition Services section, which includes the WIC program and our Child and Adult Care Food program, as well as the Food and Nutrition Services section, which is North Carolina's SNAP program that will transition to the division later this month. We all know that programs like WIC, CACFP, and FNS help children and families access healthy food, improve health and wellness, and help families weather financial distress. You'll hear from my colleague, Carla West, about the FNS program and the many silver linings for children during the pandemic. I'm going to share some silver linings about the WIC and CACFP programs. I'll start with WIC. WIC is an incredibly important public health nutrition program that works to promote healthy pregnancies, healthy birth outcomes, and healthy growth and development for women, infants, and children up to age 5. During the pandemic, North Carolina took advantage of numerous federal flexibilities to make it easier for families to access nutritious food, breastfeeding support, nutrition education, and referrals for healthcare. For example, our state leveraged the flexibility to issue benefits remotely, which allowed participants to enroll or re-enroll for WIC benefits without having to visit a clinic in person, removing a potential barrier for families. As a result, we have seen increased WIC participation. Our statewide coverage rate for infants and children has risen from an estimated 57% in October 2019 to 73% in October 2020. Another silver lining is that we were able to provide additional cash value benefits to families participating in WIC. And as a result, we've seen a tripling in the amount of fruits and vegetables purchased. Right now, these increased benefits are available through March 2022, and we're hopeful that the federal government will extend these benefits through at least September 2022. We're grateful to the local WIC agency staff across the state for supporting continued operations and for meeting the needs of more North Carolina families as we saw increased referrals during the pandemic. Our team at DHHS has heard many times from WIC participants about how grateful they are for the kindness shown by WIC staff and how breastfeeding peer counselors have helped them breastfeed for at least a year. I also want to talk about the At-Risk After-School Meals program, which provides reimbursement for healthy meals or snacks served to kids participating in after-school education or enrichment activities. Currently, we have 754 after-school programs participating in ARAM. There are 21 school districts participating in this program, which is up from 18 school districts in 2019. And while it's great to see more districts participating in ARAM, we'd like to see even more enroll in this program so that more kids have access to healthy food in the school setting. Our team at DHHS has worked to streamline the application to make it easier for school districts to apply to participate in this program. During the pandemic, we took advantage of waivers for the CACFP program that allowed participating institutions to continue to provide kids access to snacks and meals safely during COVID, including expanding the number of after-school programs that could participate in ARAM, regardless of their location, and new allowances like grab and go, meals served at different times, and letting parents and guardians pick up meals. Although we saw a decrease in the overall number of institutions and facilities that participated in the Child and Adult Care Food Program since COVID began, the silver lining is that through all these challenges, the number of snacks served increased from roughly 28,000 to 233,000. Pretty incredible from the 2019 to 2020 school year to the 2020 to 21 school year. These remarkable numbers are thanks to federal flexibilities as well as the efforts of staff. So thank you to all the staff at participating institutions from across the state. They know that children across North Carolina need these nutritious meals and snacks, and we want to recognize all of them for their dedication, determination, and hard work. Thank you.
Hi everyone, I'm Carla West, Senior Director for Economic Security with the Division of Social Services in the North Carolina Department of Health and Human Services. This pandemic has certainly brought about many silver linings to help children and families access healthy food. Pandemic EBT, or PEBT, is a partnership between the Department of Health and Human Services, the Department of Public Instruction, local education agencies, and other stakeholders to support the needs of students and children in North Carolina that are experiencing food insecurity during the pandemic. Since March of 2020, over 1.3 million children have received over $1.7 billion in PEBT benefits. The silver lining of this program has been the true collaboration between multiple state and local partners. North Carolina was one of the first states to have an approved PEBT program, and we have been able to consistently and reliably send payments to families. This would not have been a success without the collaboration between all of our programs, particularly the schools who are tracking attendance. As Madhu mentioned earlier, North Carolina has been able to take advantage of numerous federal flexibilities to make it easier for families to access nutritious foods. One of those flexibilities that was offered by the United States Department of Agriculture was to increase the benefits that households receive from food and nutrition services up to the maximum allotment available for their household size. In April of 2021, USDA further increased those benefits to ensure that each household received at least $95 in additional funds to help families purchase food during the public health crisis. In January of 2020, over 871,000 households received the maximum allotment totaling $151.8 million in benefits. That is just for 1 month. With these additional funds, households have been able to purchase healthier foods for themselves and their families that they may not have otherwise been able to purchase. Another silver lining during this pandemic has been the reevaluation of the Thrifty Food Plan that the United States Department of Agriculture conducted in 2021. The Thrifty Food Plan is used to calculate Food and Nutrition Services benefits, which has not seen an increase in a benefit payment in many years. The reevaluation resulted in a 21% increase to the average Food and Nutrition Services benefit that households receive. This will provide additional funds to families, increasing their ability to purchase healthy foods after the pandemic has ended. I want to close by expressing gratitude for the FNS staff and our local DSS agencies who have experienced significant increases in new applications, some as high as 30 to 40%, and continue to meet families' needs. In many cases, the enrollment of families in the FNS program has helped them also benefit from PEBT as well as the maximum allotments. We are so grateful for the support from our FNS staff on the front lines that continue to help children and families across the state. Thank you for everything.